In today's class, we are going to be sensitizing men who are either circumcised or uncircumcised on how they should take care of themselves or how they should better take care of themselves. And also, I'm going to be dishing out some knowledge that will give us the options on if we should circumcise our male children or if we as adults should circumcise ourselves. Good day, everyone, and welcome to my channel. I'm Gwendolyn Halley, a seasoned and certified medical microbiologist from the UK, and I bring you knowledge on health, on medicals, and a lot more. I'm also a farmer and I love business, so stay tuned for a lot more. But if you're just joining this channel, if you just stumbled on this video or any of my videos, I want to say welcome to the family. Do subscribe and turn on the notification bell so that you receive our recent uploads, and also you increase the visibility of the channel so that knowledge is spread worldwide. And if you're a returning subscriber, this is me telling you thank you. In today's class, we are going to be looking at circumcised penis, that is a cut, and the uncircumcised penis, that is the uncut. We're going to be looking at the medical benefits, we're going to be looking at the complications and the disadvantages. Now, what is circumcision? Circumcision is when the foreskin of a male's penis has been removed. And this could be either due to religious reasons, medical reasons, social reasons, and cultural reasons. So whatever reason you have in your mind, either to circumcise yourself or not to circumcise yourself, please do watch this video and see where you fall and see how you can improve the quality of your life, see how you can empower yourself so you remain a healthy individual. There are many people around the world who always compare female genital mutilation to male genital mutilation. I would like to say that anybody around the globe who tries to compare both, I think the person is being biased, because when you're talking about female genital mutilation, that is done on females who are already going through puberty. That involves a lot of loss of blood. That is done without the girl's consent and by force. That is done in inhuman conditions. That takes away the woman's ability to enjoy sexual pleasure. In fact, it frustrates her in marriage. In fact, it opens doors for a lot of promiscuity, either on her side or on the side of her husband. And also, it actually makes her to be frustrated in herself and always feel depressed because she has been abused as a little child. So let's not go into comparing, because if we are looking at male circumcision, it's either done to when he's a little boy, or it's done to a man who accepts that this is what he wants to be done. It has never been announced around the globe or shown around the globe that the men are being forced into doing male circumcisions out of their will. I know in some cultures around the world, they only do male circumcision when the man is an adult. Male circumcision does not stop a man from having pleasure during sex. Does not stop a man from having confidence in himself. It doesn't cause depression in a man. It doesn't make the man feel abused. It doesn't stop the man from enjoying his home or sex with his spouse in the future. But if you look at in the case of the woman who is being genitally mutilated, in some cases, her labias are being stitched. Now you're asking yourself, how is her menstrual blood going to flow out? In some cases, her clitoris is cut out and her labias are being cut out. That same thing isn't done to men. The corpus of his penis isn't cut out. His balls isn't cut out. In fact, the way male circumcision is done is more prudent than the way female circumcision is being done. Imagine if this woman who is prone to keloids develops keloids on her clitoris, on the area for surgery. How is she going to pee? How is she going to pass out urine? So please, people around the world, or if you are watching this video and you're trying to compare like female genital mutilation and male genital mutilation, it's different. And if you have ever met any female who has been genitally mutilated, and if you have met a man who is or has been genitally mutilated, you will find out that the woman is always depressed. She's always complaining of lack of self-esteem. She's always complaining about being abused. It's a memory that she cannot forget. She doesn't enjoy sex. How are you expecting her husband to be having a woman who doesn't even show that she's enjoying sex? But if you meet the man doesn't ever complain that he has lost sensitivity while having sex or that he doesn't enjoy sex with his spouse. So please, if you're watching this video, watch this video with an open mind. Watch this video as a human being. Now, let's dive into the first on our list, and that is hygiene conditions. Most people who are uncut, most men who are uncircumcised, always have infections on their penis. They are at higher risk of having infections on their penis. And why is that? Because underneath the foreskin, you have dead skin, oil, and bacteria that grow together. That forms a good medium to which infections can occur. And in that case, that white, cheesy, sticky substance that is normally found underneath the foreskin is what we call smegma. And with smegma, there is this smell and this inflammation and this itch that causes balanitis. When balanitis persists, it will lead to phimosis. Phimosis is when the foreskin of a man's penis cannot be pulled backwards for the man to clean. So in this case, you need to run to your doctor. And this I have to say, if you are a man and you know that your son is not circumcised, teach him these things. Teach him these things. If you're a mother and you know that your son is not circumcised, teach him these things so that your teenage son or your 5-year-old or your 7-year-old who is washing themselves should know that this is what they are supposed to do. Trust me, sexual health is very important. Hygiene is very important. Male grooming, male hygiene is very important. And there is no age where you need to start, no specific age in the books that has been written down or approved worldwide where a mother or a father should teach their child hygiene, especially reproductive or genital hygiene. So, going back to our topic, men who have been circumcised do not experience this smegma. That's because they don't have the foreskin, they don't experience phimosis or balanitis. These are infections that are very common with men who are uncircumcised. What men who are circumcised should watch out for is that because the tip of their penis is very exposed, they should watch out for the type of underwear they wear and also the type of lotions that they use or creams they use on their penis, or maybe even the condoms they use, because they are more exposed to having rashes and irritations either from soaps, either from lotions, either from condoms, either from lubricants, or either from the underwear which they wear. So they should wear more loose underwear to avoid irritation on their penis. We are going to the next one, and that is on sensitivity. On sensitivity. With sensitivity, whether you are uncut or whether you are cut, that doesn't affect your pleasure sexually. It doesn't affect the way you're going to enjoy sex. But what it does is, when you are uncut, you are more sensitive at the tip of your penis than a man who has been circumcised. Well, that's because your foreskin has been covering the tip of your penis. So, or the nerves that are found at the tip of the penis. So they are not regularly stimulated either by clothing or a lot of things. So a person who is uncut is more likely to reach orgasm or to be more sensitive sexually than someone who is circumcised. Because with a circumcised male, the tip of his penis are normally exposed, and they are not very sensitive to stimulus and to a lot of things. For example, a man who is not circumcised, if cold water, hot water is being thrown on him, he's more likely to feel the effects or have a reaction than somebody who is circumcised. The next on our list is fertility. Whether you're circumcised or not, it doesn't affect your fertility because sperms are manufactured in the testes. So don't be afraid. Don't think that because you are circumcised or maybe you are not circumcised, most probably that's why you can't get a woman pregnant. That has nothing to do with it. Our next point is infections. Now, men who are uncircumcised are more likely to have urinary tract infections. That's because of the smegma that is found underneath the foreskin. The bacteria, the oils, the dead skin, they're more likely to find their way into the urethra and cause urinary tract infections. Unlike the men who are circumcised, they don't really have urinary tract infections caused by smegma. The urinary tract infections are mostly caused from pathogens or microorganisms from the anus or from other sources, but not from smegma. So men who are uncircumcised are more likely to have on a regular basis urinary tract infections. And the next on our list is penile cancer or cancer of the penis. With men who are uncircumcised, they are more at risk at having penile cancer. That's because of the smegma and the phimosis. That the phimosis is, as I explained earlier, is when the foreskin has been infected and it cannot be pulled backwards. So the skin is more likely to be inflamed, itch, and also an accumulation of viruses can just attack it, and then you have penile cancer. So this is something that men who are uncut should really look into and really look into their hygiene, that they really clean themselves on a regular basis. In fact, whenever you get into a very busy activity, especially if it's humid, make sure you wash yourself twice a day. And when it comes to sexual intercourse, make sure you wash yourself properly. And also, when it comes to infections, a man who is uncircumcised is more likely to cause vaginal infections in the woman if he doesn't clean himself properly. Because this smegma, that's this cheesy, sticky substance, whitey substance that is found underneath the foreskin, will then enter into the woman, that could be his spouse, and the woman will constantly be having vaginal infections. And in this case, particularly bacterial vaginosis. So this is something that you should take a look into, because there are a lot of microorganisms that can actually settle underneath or begin to grow underneath the male foreskin, the foreskin of a man that is uncircumcised. In fact, I'm going to advise that if you are uncircumcised, before you have sex with your spouse, make sure you wash yourself to avoid, causing vaginal infections in your spouse. This is very important. And for a man who is circumcised, the risk of him having penile cancer is really low. Now we are going to look at the complications that come with circumcision. The first is the scarring. Now, there are some men that have been scarred because there are different methods of circumcision, and every community and every country does it differently. So there are some people who experience scarring. In fact, the scarring is so much at the tip of the man's penis, at the the at the head that, even when he's having sex with his spouse, the woman is in pain because the scarring is uncomfortable. Next on our list when it comes to complication is infection. You run the risk of having an infection. Yes, I know the infection may be treated, but in that case, if it's not handled properly, then imagine what could happen. Now, the third complication that could occur during circumcision is when too much skin is being cut out. And I'm talking about circumcision on a male child, like when too much skin is being taken out, is being cut out, then it doesn't leave enough room for the child's penis to grow properly. And that leads into this boy or this male growing up to have a small penis or have complications in the future. Sometimes too much skin is taken out. Sometimes the skin is pulled so hard that it doesn't give enough space for the muscle, in short, the penis to grow well. And the child is in constant pain. That means at some point, whenever the person has an erection, the person is in pain. So please, if you want to go for circumcision, please make sure you go to a certified medical, clinic. If you want to carry out circumcision on your male child while he's a baby, do it where the professionals know what they are doing. Now, if the child is a teenager, if the person is an adult, yes, I know the bleeding is going to be much, but then the person's penis would have grown to size, would have matured. The male's penis will actually grow to the normal length he was supposed to have as per his DNA, as per the way God had created him to be. But when too much of skin is being pulled out and is being stretched too much and healing occurs, what happens then when there's not enough space for the penis to really grow properly? I don't know if you understand what I mean, but I know that medical professionals understand what I mean. I know you understand exactly what I mean. I know some people will say, but the skin is still growing, the skin is still, you understand. But there are some people who take out a lot of skin instead of just nipping it out and doing it, leaving a lot of allowance that the baby's penis can be growing as he is growing while breastfeeding. And sometimes these cuttings or this circumcision actually limits the growth, the length of the child's penis. So put that into consideration. This will not affect an adult. This point will not affect an adult or a teenager who wants to get circumcised. The risk of being circumcised while you're an adult or a teenager is that you run the risk of losing a lot of blood, but that could be controlled. And if it's done by professionals, that is why you shouldn't go to a nurse to do it. A nurse could do it on a baby. Some mothers, when the child is just born, immediately they just do it. As they're cleaning the child, they just circumcise the child. While some come back like a month later or a few weeks later or 2 weeks later to get their child circumcised. But if you want to get circumcised as an adult male, you just run the risk of bleeding, and that could be controlled. And that's why I advise that you go and meet a professional, a specialist who will get that done. And the pain will go away in a while. I know that you'll be asked to stay away from some activities, but the healing will go smoothly. Thank you for joining me into this class and for all your questions. Thank you for watching. Till next time, I remain your seasoned and certified medical professional, Gwendolyn Halle.